The test item cluster for mechanical neck pain that benefit from thoracic manipulation. 1. Symptoms lasting less than 30 days. 2. No symptoms distal to the shoulder. 3. A fear avoidance belief questionnaire, a physical activity score less than 12. 4. Looking up doesn't aggravate the symptoms. 5. Diminished T-spine kyphosis. And 6. Cervical extension range of motion of less than 30 degrees. All right, can you look up for me? Good. The test item cluster for full thickness rotator cuff tear. Number 1, drop arm test. Go ahead and lower your arm slowly to your side. Any pain with that?
Nope.
Good. Number 2, painful arc sign. I want you to raise your arm up to your ear. Good. Any pain with that?
Mm-mm.
Number 3, infraspinatus muscle test. Right. Arm at your side, thumb up. I'm going to push against your arm and I want you to hold it there. Ready? Hold, hold, hold. Good. Any pain with that?
Nope.
The test item cluster for subacromial impingement. 1, painful arc sign, as previously demonstrated. 2, infraspinatus muscle test, also previously demonstrated. And 3, the Hawkins-Kennedy test. Okay, you're going to bring your arm up here, bend your elbow. Any pain? Good. The test item cluster for mechanical neck pain that benefit from cervical manipulation. 1, symptoms lasting less than 38 days. 2, expectations that manipulation will help. 3, pain with posterior to anterior testing at the mid-cervical spine. 'Any pain with that?
Nope.
4, cervical rotation range of motion difference of 10 degrees or more. Look as far as you can to your left. Good, and back to center. Now look as far as you can to your right. Good, and back to center. Test item cluster for cervical radiculopathy. 1, positive upper limb tension test of the median nerve. To further sensitize this test, I would have the patient side bend to the contralateral side. Can you please bring your right ear to your right shoulder? Yep. 2, the Sperling's test. Have you look up? Over to this side. Distraction test. Less than 60 degrees ipsilateral cervical rotation. Okay, go ahead and look to your left. Good. Back to center. Look to your right. Back to center. Upper limb tension test for the radial nerve. To further sensitize this test, I'd have the patient side bend to the contralateral side. Can you take your right ear to your right shoulder, please? Good. With a C5, C6 radiculopathy, I would test dermatomes, myotomes, and reflexes at the C5, C6 level. For the C5 dermatome, I would test sensation to find loss of or sensation differences bilaterally. Does this feel the same as this?
Yes.
Good. For the C5 myotome, I'll have the patient bring your elbows up to my hands. Good. And hold there and don't let me push down. Hold, hold, hold. Good. So for C6 dermatome, I'll brush my hands along the C6 path of the lateral forearm, thumb, and finger of both sides. Does this feel the same as this?
Yes.
For the C6 myotome, I'll have the patient hold his elbow in flexion, hold your arm here, and don't let me pull away. Hold, 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 hold. Good. I'll then check extension of his wrist in extension. Don't let me pull away. Hold, hold, hold. Good. And then I'll check bilaterally. I will then check his reflexes. Go ahead and check your bicep reflex. Good. And his brachioradialis reflex. And that's how I would differentiate between C5, C6 radiculopathy and a rotator cuff tear. Active compression test of O'Brien. Okay, I'm going to have you lift your arm up to here, bring it in a little bit. Good. Thumb down, and don't let me move you. Hold, hold, hold. Good. And now palm up, same thing, don't let me move you. Hold, hold, hold. Good. Any pain with either of those?
Nope.
Good. The Sharp-Purser's test is used to determine a subluxation of the atlas on the axis. For this test, I'll have the patient sitting. I'll put my hand on his forehead and my thumb on the spinous process of C2. I'll then have the patient flex his head forward. So go ahead and bend your head forward for me and apply a pressure at the forehead at the same time. The Neer's impingement test is used to determine if there's an overuse injury to the supraspinatus muscle or the biceps tendon. All right, so go ahead and relax your arm. Medially rotate. The sulcus sign is a test for inferior shoulder instability. For this test, I'll have the patient standing with his shoulder complex exposed. I'll then apply a downward force on the humerus. The presence of a sulcus sign may indicate inferior instability or glenohumeral laxity. This test will then be tested bilaterally to compare.